Well, you know it, the hot summer days are here. So with us today is Dr. Shane Hudnall with Cone Health Sports Medicine Center to review how to stay safe in the summer heat and what we all should know about heat-related illnesses. So thank you so much for joining us.
Thanks for having me.
All right, let's get started. So heat stroke and heat exhaustion, what are they and how concerning are they?
So heat stroke is what we worry about the most, of course. I mean, that's when your body's thermostat basically is not able to control your temperature. Your temperature gets above about 104 degrees, and then you can start to get neurologic symptoms. The most common ones that we see are like loss of consciousness or confusing. And we've seen people die from that. So that's why it's important to recognize it and treat it if appropriate. Yeah.
What are the warning signs?
So some of the warning signs that you're getting mild heat illness, which can lead up to that, of course, are maybe some of the things many of us have had. So you get a little bit of a headache, maybe some muscle cramping, feel a little dizzy. Those are the things you need to, listen to your body there. Go inside if you can, or get into a shaded area and take the proper precautions so you don't end up with heat stroke.
Are the warning signs different when it comes to children versus adults, or are they the same? Or
They're pretty much the same, but as you can imagine, most kids won't be as verbal about their symptoms. So you may notice them kind of slowing down, or the way that they'll describe that they might have the heat affecting them might be something like, I feel hot, or Mom, Dad, I don't feel right. Those are some things to take note of, and especially when it's 90, 100 degrees outside like it has been, to take them inside.
Okay, so that's kind of some of the things that they might say. Let's go getting into the next question. Is it something that they might do if they, say that they're maybe not feeling well, but they don't really communicate it maybe properly, looking out for their actions?
Especially the younger they are, of course. Now, some of them may say, like, my head hurts, or, my stomach hurts, maybe, something like that, or I feel like I'm going to pass out. But you may just notice that they're slowing down. Like, my kid's usually running around a bunch, and they're not quite doing that. And especially on days like this, you have to take notice of that.
Yeah. Any time limits for kids playing outside when they should come on inside?
As you can imagine, just the hotter it is and the more humid it is, the more breaks you should have them take and bring them indoors. But there's not like a set limit. You want to try to, especially between the hours of 10 a.m. and 4 p.m., when it's the hottest, the sunniest usually, that's when you want to be a little bit more cognizant of that.
Okay. And if you or someone you are with becomes really overheated, what should the next steps be to get them some help?
Yeah, good question. So the first thing I'd say is, bring them indoors. Now, if you're out at a park or something and that's not something that you can do, get them like under a tree or under a pavilion, somewhere that's shaded. If you notice that they have some excessive clothing, like they're wearing a jacket for some reason, or pants, when they have shorts underneath, removing that excessive clothing so that their arms and legs can be exposed so they can, sweat some of that off. If you have access to ice, if ice is available, an ice pack, putting it, on their neck, on their chest, stomach, just anywhere to help cool them off. If they haven't gotten confused or lost consciousness, of course, having them drink cold fluids is very important. And just, if you notice that they're becoming more confused, maybe hallucinating, saying things that don't make sense, that's when you need to call 911. Do those other things that I mentioned, but then call 911 as fast as possible.
Yeah, that's a good advice there. Anything that you shouldn't do when you're noticing these things?
Well, don't push through it, I guess, especially if you're exercising in this heat. A lot of us are training for races or something. You've got a triathlon coming up. Let me just push through these next few miles. If you're noticing you're having heat illness, take that seriously, and make sure you just get indoors and postpone that training run if you need to.
What medications should people be aware of that may increase their risk of heat illnesses?
So I think about a couple classes of medications that can increase your risk. So the first, a lot of us are on blood pressure medications, and there are certain ones like diuretics, like hydrochlorothiazide, that make you more prone to dehydration, which increases your risk of heat illness. And then the other one would be a beta blocker like metoprolol, can impair your body's ability to sweat. The other class of medications are allergy medicines like Benadryl and Sudafed, kind of same thing. They can also reduce your ability to sweat, which is important to keep us cool in this heat.
Yeah, absolutely. And besides medication, what other factors should people be aware of that may mean they need to be extra cautious when in those hot conditions?
Well, I think the temperature, gets most of the focus, but you really have to think about the humidity too, especially here in North Carolina. That however wet it is outside, the higher the humidity, you know, we need it to be dry for that sweat to evaporate from our skin and cool us off. So the more humid it is, the harder it is to battle the elements like that.
Yeah. What steps should people take to prevent getting overheated?
So, like I mentioned before, I think avoiding the hottest times of the day between 10 a.m. and 4 p.m., making sure that you hydrate. That's very important. Wear loose, light-fitting clothing. If you can, if you're outdoors, having your arms and your legs exposed, make sure you're wearing sunscreen, of course. But that allows that sweat to evaporate and cool us. If you're going to be in bright sunlight, wearing a hat is really good too. And like I was mentioning about exercising, just be aware that it takes up to 14 days to acclimate yourself to exercising in that kind of heat. So take it slow and work your way up.
And speaking of staying hydrated, what beverages are recommended and then what beverages should be avoided?
Lots of water. Water is your friend, especially if you're going to be outdoors for less than an hour. And then we like, some of those drinks with electrolytes might be important beyond that. Caffeine and alcohol are probably things that you want to avoid. But water is still the mainstay. There's nothing better than that for sure.
What about Gatorade and all those other drinks that are, in the family of Gatorade?
Yeah, so those are important, especially if you're outdoors. You're going to be outdoors, you're working in the yard for maybe a couple hours or something. Anything more than an hour, you probably need those electrolytes that you'll see in drinks like Gatorade or Powerade. And that also helps provide you with the carbohydrates, when you're outside or if you're exercising. You really need those glycogen stores back up to get your energy out there.
Okay. And are there food items that could help with hydration before or after being in the heat?
Really, I just go back to water. So the food will be important as far as replacing your energy stores. But I think beverages are the way to go. Water, but if you're going to be out more, those electrolyte drinks.
What would be your final message about, staying safe in the summer?
So make sure you know the signs of heat illness. Pay attention to them. Listen to your body. You're getting a mild headache, something like that. Your muscles are cramping. You're outside and it's hot. Go inside. Don't power through it. Go inside. Take care of yourself. Stay cool. Take frequent breaks. Take care of yourself.
I have to ask another question. This just came to my mind. Because,
Sure.
a lot of kids and even adults too love our popsicles and slushies and things of that nature. How is that when you're out in the summer heat? I mean, is it good to have them in portions? Should you avoid drinking those all the time? What would you say?
I thought you were going to offer me a popsicle. I'm really excited.
I really wouldn't mind having one either.
You're right. I'm gonna get one. So again, you have the liquid from that. They cool your body off. It's just like drinking a cold liquid. It kind of cools you down. It also has some sugar in it to kind of get your energy stores back up. So if water is not available, and my kids love them, and I'm not gonna lie, I love them too. A good popsicle is good too.
All right, good stuff. Thank you so much. Of course, if you missed our entire conversation, you can find it on WFMYnews2.com.